While families across America choose between paying rent or buying insulin, while cancer patients ration chemotherapy because they can't afford treatment, and while medical bankruptcies destroy lives every single day, there's a small group of executives who've turned human suffering into a lobbying gold mine. These aren't just statistics, these are real people whose pain funds a political machine designed to keep America as the only developed nation where healthcare bankruptcy exists. Today, we're exposing the three biggest contributors to American healthcare lobbying, the architects of a system that prioritizes profit over patients. These individuals and organizations have spent hundreds of millions of dollars ensuring that Americans continue to pay the highest healthcare prices in the world, while receiving outcomes that rank near the bottom among developed nations. This isn't about politics. This is about following the money trail that leads directly to why your grandmother can't afford her heart medication. Before we dive into our rankings, let's establish our reference point with someone who became a symbol of this system's priorities. Brian Thompson, the former CEO of United Healthcare, who was tragically killed in December 2024, represents exactly what we're talking about. Thompson earned $10.2 million annually while overseeing a company that denied 32% of insurance claims, double the industry average of 16%. Under Thompson's leadership, United Healthcare's profits surged from $12 billion in 2021 to over $16 billion in 2023, while the company generated $281 billion in revenue. That's $10.2 million in executive compensation extracted from a system that systematically denies care to the very people paying premiums. Thompson's salary alone could have covered the medical expenses for thousands of families, yet it went to an executive who profited from denying care. The words deny, defend, and depose found on bullet casings at Thompson's killing weren't random. They represent the three-pronged strategy insurance companies use to avoid paying claims. While we absolutely condemn violence, we cannot ignore that these words reflect the deep frustration Americans feel with a system that enriches executives while bankrupting patients. Healthcare lobbying has exploded by 70% over the past 2 decades, reaching nearly $714 million in 2020, compared to $358 million in 2000. In 2024 alone, healthcare interests spent over $562 million on lobbying, more than any other industry. This isn't money spent on improving care or lowering costs. This is money spent ensuring the current profit-driven system remains exactly as it is. According to data from Open Secrets, Modern Healthcare, and other tracking organizations, the pharmaceutical and health products industry alone spent $387 million on lobbying in 2024. The insurance industry added another $157 million. Hospital associations contributed over $134 million. All of this money flows to one purpose: preventing any meaningful reform that might prioritize patients over profits. Coming in at number 3 is Rick Pollack, President and CEO of the American Hospital Association since 2015. While Pollack himself doesn't personally contribute to these funds, he controls the organization that spent $21.3 million on lobbying in just the first 3 quarters of 2024. Making AHA the second largest healthcare lobbying spender behind only pharma. Pollack oversees nearly 5,000 member hospitals and health systems, managing an organization with sophisticated political networks in every congressional district. The AHA consistently ranks among the top 3 healthcare lobbying spenders, having spent over $2.5 billion on lobbying from 1998 to 2025. In 2023 alone, the AHA spent $30.22 million on lobbying efforts. What makes Pollack's leadership particularly troubling is the timing. While hospitals received billions in COVID relief funds and were hailed as heroes, many of these same institutions have since laid off workers, denied charity care, and pursued aggressive debt collection against patients who couldn't pay medical bills. Under Pollack's watch, the AHA has consistently lobbied against price transparency measures and opposed efforts to limit surprise medical billing. The hospitals Pollack represents generate enormous profits, many reporting margins of 15 to 20%, while claiming financial hardship to justify high prices. These institutions benefit from the tax-exempt status worth billions annually, yet they spend millions lobbying to maintain a system where hospital prices remain opaque and medical debt drives families into bankruptcy. Rick Pollack's AHA doesn't just lobby for hospitals. It lobbies for a system where hospitals can charge $100 for an aspirin and $1,000 for a bag of saline solution. Every dollar the AHA spends on lobbying is a dollar invested in keeping healthcare prices artificially high, ensuring that hospitals can continue extracting maximum profit from sick Americans. At number 2, we examine the insurance industry's lobbying machine, recently led by Matt Iles during his tenure as CEO of America's Health Insurance Plans, or AHIP, from 2018 to 2023. While Iles has since departed, his leadership represents the insurance industry's systematic approach to maintaining the status quo. Under Iles' direction, AHIP managed an annual budget of $65 million and spent over $9.2 million on lobbying in 2024. But Iles' influence extends far beyond AHIP's direct spending. He coordinated with major insurers like United Health Group, which spent $5.9 million on lobbying, Cigna at $6.8 million, and Blue Cross Blue Shield associations that collectively spent over $20 million. The insurance industry as a whole spent nearly $3.8 billion on lobbying from 1998 to 2025, with 2024 seeing $157 million in lobbying expenditures. This represents a coordinated effort by companies that generate hundreds of billions in revenue while denying essential care to millions of Americans. What makes this lobbying particularly insidious is its purpose: maintaining a system where insurance companies can collect premiums while systematically denying claims. Companies like United Healthcare, which generated $281 billion in revenue while denying 32% of claims, spend millions lobbying to preserve their right to take your money while denying your care. Iles and the insurance lobby haven't just maintained the status quo. They've actively worked to expand it. They've lobbied for Medicare Advantage plans that now cover nearly 30 million seniors, plans that use AI algorithms to deny care and generate massive profits for private insurers. They've fought against single-payer systems that would eliminate their profit margins entirely. The insurance industry's lobbying success is measured in human suffering. Families declaring bankruptcy after cancer diagnoses, diabetics rationing insulin, and patients avoiding emergency rooms because they fear the financial devastation. Every lobbying dollar spent by the insurance industry is an investment in maintaining their right to profit from human pain. At the top of our list sits the undisputed king of healthcare lobbying, the Pharmaceutical Research and Manufacturers of America, known as PhRMA. This organization spent a staggering $31 million on lobbying in 2024 alone, making it the single largest healthcare lobbying spender in America. PhRMA's lobbying expenditures dwarf even their closest competitors. In just the first 3 quarters of 2024, pharma spent $24 million, nearly $3 million more than they spent in the same period in 2023. Over the past decade, pharma has consistently outspent every other healthcare organization, pouring hundreds of millions into maintaining a system where Americans pay the highest drug prices in the world. But pharma's influence extends far beyond their direct lobbying. They coordinate with member companies like Pfizer, which spent $11.6 million on lobbying, Amgen at $8 million, and Johnson & Johnson, Merck, and Bristol-Myers Squibb, which collectively spent over $47 million lobbying between 2022 and 2023. This represents a coordinated industry effort to prevent any meaningful drug pricing reform. The numbers tell a devastating story. Pharma member companies pulled in $367 billion in sales in 2023, while spending $95.9 billion on research and development. However, they spent $162 billion on stock buybacks, dividends, and marketing, nearly double their R&D spending. They paid executives almost $500 million in compensation while spending $57.8 million on lobbying and $83.2 million on trade association dues. Pharma's lobbying has become ruthlessly effective. They've prevented Medicare from negotiating drug prices for decades, blocked importation of cheaper drugs from other countries, and maintained patent systems that allow for endless price increases on life-saving medications. Their lobbying efforts have kept insulin prices artificially high, forcing diabetics to ration life-saving medication. What makes pharma's lobbying particularly grotesque is the human cost. Americans routinely travel to Canada or Mexico to buy the same medications at a fraction of U.S. prices. Cancer patients go without treatment because they can't afford drugs that cost pennies to manufacture but sell for thousands of dollars. Families watch loved ones die because they can't afford medications that would be accessible and affordable in any other developed nation. Pharma doesn't just lobby for high drug prices. They've created an entire ecosystem of patient advocacy groups, think tanks, and political organizations designed to maintain their monopoly on human suffering. They've poured millions into conservative groups to oppose single-payer healthcare and funded moderate Democratic groups to water down drug pricing reforms. What makes these lobbying efforts so effective isn't just the money. It's the revolving door between government and industry. Pharma alone employs 123 lobbyists who previously held government jobs. These aren't just advocates. They're former regulators, congressional staffers, and government officials who wrote the very rules they now help companies circumvent. The American Hospital Association maintains sophisticated political networks in every congressional district, ensuring that local hospitals can pressure representatives directly. Insurance companies coordinate their lobbying efforts to present a united front against reform that might prioritize patients over profit. This is not lobbying for better health care. This is lobbying against better health care. Every dollar these organizations spend on lobbying is a dollar invested in maintaining a system that bankrupts families while enriching executives. No other developed nation allows this level of healthcare profiteering. Countries like Germany, France, and the United Kingdom provide universal healthcare coverage at half the per capita cost of the American system, while achieving better health outcomes. These nations have regulated pharmaceutical prices, nonprofit hospital systems, and insurance models that prioritize care over profit. The difference isn't medical technology or doctor quality. It's political will. Other countries have refused to allow healthcare to become a profit center for wealthy executives. They've recognized that healthcare is a human right. not a commodity to be traded for profit. Meaningful healthcare reform in America faces an almost insurmountable challenge. The same organizations that profit from the current system are the ones with the most money to influence politicians. Pharma's $31 million in annual lobbying can fund dozens of congressional campaigns. The AHA's $21 million can ensure that hospitals' interests are represented in every major healthcare debate. Real reform would require several fundamental changes. Medicare for All would eliminate insurance industry profits entirely. Drug price negotiations would slash pharmaceutical profits. Hospital price transparency would end the ability to charge arbitrary prices for basic care. The people who need these reforms are the least able to fight for them. Families struggling with medical debt don't have millions to spend on lobbying. Cancer patients worried about affording treatment can't compete with pharmaceutical executives protecting their bonuses. The wealthy executives profiting from our broken healthcare system have unlimited resources to maintain the status quo. They can fund think tanks to produce studies supporting their positions. They can hire former government officials to lobby their old colleagues. They can run television ads claiming that reform would hurt patients while they're literally profiting from patients' suffering. Breaking this cycle requires recognizing that healthcare lobbying isn't about improving care. It's about protecting profits. While pharma spends $31 million lobbying against drug price reforms, they are not protecting innovation. They're protecting their ability to charge $300 for insulin that costs $3 to manufacture. When the American Hospital Association spends $21 million lobbying against price transparency, they're not protecting quality care. They're protecting the ability to charge unconscionable prices while claiming nonprofit status. When insurance companies spend hundreds of millions lobbying to maintain the current system, they are not protecting patient choice. They're protecting their right to collect premiums while denying claims. The three biggest contributors to American healthcare lobbying represent a coordinated effort to maintain a system that prioritizes profit over patients. Pharma's $31 million, the AHA's $21 million, and the insurance industry's collective spending create an ecosystem where human suffering generates political influence. These are not public servants working to improve healthcare. These are profit-maximizing executives who've turned American pain into political power. Every family that declares bankruptcy due to medical bills, every patient who dies because they can't afford treatment, and every person who rations medication contributes to the wealth these organizations use to lobby for even more profit extraction. The solution isn't complicated. Other countries have proven that universal healthcare systems work better and cost less. The challenge is overcoming a political system where the people profiting from our broken healthcare system have the most money to influence politicians. Until Americans recognize that healthcare lobbying is essentially legalized bribery designed to maintain a system that kills profit for people, we'll continue to be the only developed nation where medical bankruptcy exists. The choice isn't between different healthcare policies. It's between a system designed for patients and a system designed for profit. The executives and organizations on this list have made their choice clear. They've chosen profit over patients, wealth over wellness, and political influence over human dignity. The question is whether Americans will continue to accept a healthcare system designed by lobbyists who profit from our suffering, or demand the same healthcare rights enjoyed by citizens in every other developed nation.